hope you all are alright. So today I'm going to make a strategy for you to use in your Plab 2 examination. Okay, you can use the same strategy for Plab 2, for CSA, or for UKMLA, or for any OSCE exam. You need to be aware that in these type of exams, the examiners are testing you in three main domains. First one is data gathering domain, and the second is management domain, and the third one is your interpersonal skills. So what I'm going to do, I will make a short series of videos to cover data gathering and management for each case scenario. So I will make a video for each medical scenario, giving you the general knowledge and the background that you need to know about each case to fulfill your data gathering and management skills. After that, I will make another video about the same medical scenario as a live simulation to show you how to use this background or knowledge from data gathering and management and to show it in interpersonal skills way. So let's not waste any more time, and I will now focus on making a strategy for you to use it in every single case to fulfill the first domain, data gathering, and the second domain, management. Alright, so when you have a patient and you need to start with taking data gathering includes history taking and examination if needed. So history taking wise, you need to start with the presenting complaint, and you need to be aware that you need to start with an open question so you can have a good idea about the patient agenda. So first thing, how can I help you today, Mr. Smith? What brought you to the hospital or what brought you to the clinic? Okay, and don't jump to ask the patient more questions in that minute. It's called the golden minute. Let the patient do the work for you. Let the patient say whatever he has in his mind, and after he answers, for example, doctor, I have headache, just ask him, can you give me more details about this headache? Can you tell me more? So give him the opportunity to help you. After this point, you need to go to the second point, which is asking closed questions to rule out differential diagnosis and red flags. For example, Mr. Smith, did you have any fever with this headache? Have you had any neck stiffness? Or have you had any rashes? So this kind of closed question will help you to rule out any red flags or differential diagnosis. Third point you need to take care of is to ask general questions, which you need to ask in every single case to make sure you're not missing any cue or clue point. These general questions include past medical history, medication and allergies, any family history of related condition or anything the same, or social history as well of smoking and alcohol habit, and ask about work and home life. This set of general questions you can include in every case, and you might find a hidden agenda in any of those. Fourth point, you need to ask the patient about the impact of his presentation on his life, and life includes home life and work life. Mr. Smith, did it affect your work by any chance? How is your home setting? Do you find it difficult to cope at work? And fifth and last point in data gathering is to make sure you are using ICE technique. ICE means idea, concern, expectation. Engage the patient with you. Ask him, what do you think it could be? Have you thought about anything specific? And ask him, do you have any concern, Mr. Smith? And then you will ask about his expectation in the management part. So if you cover these 5 points in the data gathering, you should be fine. You should be able to score a full mark for data gathering skills. Alright, as we said, data gathering includes history taking and examination if needed. Just make sure if you are going to do any examination to offer a chaperone, okay, and as well to give the patient a reason why you are going to touch him. So if you are going to examine his abdomen, Mr. Smith, may I examine your abdomen to make sure there is no masses or there is no features of any illnesses we are worried about, okay? Just give him a reason why you are going to touch him. That's a good practice. Alright, so let's go to the second capability or the second domain that you will be tested for. It's management. Management part, you need to make sure you touch the coming few points. First thing, to give the patient a diagnosis or a suspected diagnosis, you need to make it in a simple way. Okay, don't give him a jargon or a medical term, so make it as simple as possible. Like for example, if the patient is known to have heart failure or you are thinking about heart failure, tell him, Mr. Smith, the heart is like a muscle, and this muscle has its own supply, and heart failure means that this muscle is not working as efficient as it should be. Okay, or your heart is failing to do the job as it was doing before. Okay, and then you need to check his understanding. Make sure to give him points by points and to check that he is following you. Are you following me, Mr. Smith? Is that clear to you? Please stop me if things are not clear enough. Alright, and then as I said, use ICE through the consultation. Okay, here you need to focus on expectation. You need to ask the patient, what do you expect me to help you today? Is there anything in your mind you think I might be doing today to help you? That might change the consultation a lot. That might guide you to a different way. So don't forget this one. And then make sure it's a shared management plan. Like for example, if the patient has depression and you have few options for treating depression, you can tell him, Mr. Smith, to help you with your mood, we have few options to offer or to help you with. We can give you medication which can help to balance the chemicals in your mind, in your brain. Would you prefer that? Or we have a counseling service. We can help you with counseling session or counseling therapy. Which one do you think will be better for you? Which one does suit you? So, and then the patient might give you a clue or an idea what's his agenda or what does he like, so you can go along with that. In every single scenario, make sure to give a leaflet about the condition or to signpost for a resource. Mr. Smith, I'll give you a website you can have a look at and you can get more information about this condition, and please do let me know if you have any questions. Okay, and don't forget, in every case scenario as well, even if it's virtual or it's not true, but you need to do it to show that you are a safe and a good doctor. Follow up, give a follow-up appointment. Even if you are referring the patient, give him a follow-up appointment to check his well-being, his compliance, or to check if he has any questions that you might need to answer in the future. So Mr. Smith, I'll be happy to see you in a week time or 2 weeks time to address any questions you have or to check how you are coping with the medication. And as well, last thing in management, you need to tell some safety nettings about anything. Okay, if you have any chest pain or shortness of breath, please seek immediate help, or if you are not getting better, please be in touch. Alright everyone, so if you can cover these few points in every case for data gathering and the management, you really should be able to achieve a full mark. You will only be missing one important thing, is to show your interpersonal skills. And don't be worried about that. As I told you, I will make a video about each case scenario to show you how you can use this basic knowledge about every case to show your interpersonal skills. Thank you, and hope anyone could find it helpful. And if you have any suggestions or preferences for the coming videos or for the coming scenarios, please comment below. Thank you.